New York City is facing its biggest housing crisis since the Great Depression. There are more than 80,000 people sleeping in the city's shelters, 90% of whom are people of color. The trauma of homelessness, combined with the ongoing impact of systemic racism, contribute to higher rates of chronic disease and acute illness. Despite their increased need for healthcare services, people experiencing homelessness face significant barriers to accessing primary and behavioral healthcare, resulting in higher use of emergency health services. As people cycle through hospitals, shelters, and the street, New York City's healthcare, homeless services, and housing systems lack the coordination and resources necessary to deliver high-quality and efficient care. The Health and Housing Consortium is uniting these systems so they can better serve New Yorkers with unmet health and housing needs.
The consortium was formed in 2011 by a group of colleagues in the Bronx who came together to discuss how we could work better with one another, understanding that health and housing are inextricably linked. That spirit of collaboration has carried through in the years since, as the consortium has grown to operate citywide, reaching more than 4,000 people from over 300 organizations each year. We work to bridge the divide between the healthcare, housing, and homeless services systems in New York City. And we do that in 3 ways. The first is our training program, which gives the health and human services workforce access to the education and resources that they need to better serve their clients and patients. The second is through cross-sector collaboration. We hold different events that bring people together so they can break down barriers and coordinate their work for better outcomes. And that can include anyone, from caseworkers to executives to policymakers. Finally, we do research and advocacy. We're trying to understand what are the needs of people who are interacting with these systems, and we're identifying gaps and advocating for resources for those folks. Our ultimate goal is to improve health equity and housing stability in New York City.
So when you think about the different partners that the consortium convenes, we have managed care entities, we have hospitals, we have social service providers, housing providers. They may have different approaches, they may have different goals, but what the consortium does is takes these really large, complex concepts and systems and really distills it down to the practical, helping them to understand and be clear on what their shared outcomes are, and then strategize from there.
We use this phrase, housing is healthcare. That is the secret sauce. Giving somebody a beautiful place to live with the right supports is the foundation for changing people's lives.
At its heart, the consortium is an incredibly generous, welcoming, inclusive organization, and they have a unique ability to bring together people from all different types of programs in a really productive way.
The consortium has been spending more than a decade developing those relationships and gaining that trust in our community, demonstrating that we have the expertise to find common knowledge and purpose across sectors.
One of the greatest pleasures of being a member of the consortium is the camaraderie and the sharing and the non-competitive approach to problem solving, and getting a more in-depth understanding of how each of the systems is trying to coordinate and help people.
The consortium is working for systems change to improve the way that these systems work for people. But we also recognize that for the individual, the worker who has a client or a patient, they need information and resources now to help them navigate these systems. So we really take both of those approaches.
I'm very proud to be part of the consortium and its ability to bring community members together, its ability to be a quick response, right? Something is going on that's affecting people in New York City, and they're on there to provide the training, to provide the support, to provide any technical assistance. I think that's special. I don't think there's a lot of organizations that operate that way and are really focused on client outcomes, really focused on frontline staff.
Policymakers can sometimes be disconnected from what's happening on the ground, and the consortium has all of these relationships with frontline workers who are doing this work every day and can help inform those policymakers about what the realities are, what the challenges are, and give recommendations for how we can make these programs work better.
While we're all about policy and systems change, at the end of the day, at its core, it's personal. It's about the individual, it's about families, it's about community. And when we start from there, that's when we make really sound policies that could have impact on generations.
We exist entirely to bring people together, identify issues, and keep the momentum going to find better solutions. Our work is as strong as the people who are a part of our network, and so we really hope that you will join us and help us to improve the health and housing systems in New York City.